关于先天性耳。
It is my great pleasure to be here with you today, and it is my great honor to be with you today, and I thank you all for coming. I also want to thank Hong Yan and Professor Dr. Bong and the doctors and people at Unicare Hospital for inviting me to share my thoughts on congenital oral atresia. So I'm from the state of Virginia, which if you look at the capital of the United States, Washington, D.C., Virginia is just below our country's capital. The city is Charlottesville in the middle of the state of Virginia. We are located at the foot of the Blue Ridge Mountains. From the state of Virginia,
我来自弗吉尼亚州。
which if you look at the capital of the United States, Washington, D.C., Virginia is just below our country's capital. The city is Charlottesville in the middle of the state of Virginia.
Charlottesville 就是他来的这个城市在弗吉尼亚中部。
We are located at the foot of the Blue Ridge Mountains, and
这个山地脚下。
the major landmark in Charlottesville is the University of Virginia, founded by Thomas Jefferson, our third president in 1819. So as you all know, ears come in lots of different shapes and sizes. We call the small ear microtia. And when children have microtia, it is often accompanied by a failure of the ear canal to open, which is what we call atresia. In congenital oral atresia, the ear canal is closed, there is no eardrum, and there is underdevelopment of the middle ear space. The prevalence in the literature is about 1 in 10 to 20,000, but as Hong Yan and I have discussed, it seems to be more common in Asian countries. The majority are in one ear or unilateral.
70%的情况下是单侧的。
Boys are more commonly affected than girls, and for reasons that we do not know, the right ear is more commonly affected than the left ear. When the ear canal doesn't open, the resultant hearing loss is called a conductive hearing loss because it's a problem with the conduction of sound to the inner ear. So we discussed two kinds of hearing loss. If you look at this picture of the ear, sound comes to the ear canal, it vibrates the eardrum, and vibrates 3 ear bones in the middle ear. They carry the vibrations to the cochlea. The cochlea is the inner ear. The cochlea converts the vibrations into an electrical signal, and that electrical signal travels down the hearing nerve to the brain. In some children and many adults, the most common form of hearing loss is nerve hearing loss, which is a problem in the cochlea. Children with atresia or other kinds of problems with the ear canal or the eardrum, we call that type of hearing loss a conductive hearing loss. In children with atresia or other kinds of problems with the ear canal or the eardrum, we call that, it's important to understand how the ear develops, because the ear develops from 2 separate systems. The cochlea, or the inner ear, develops from one area, but the ear canal and the middle ear develop from a separate area.
耳蜗形成在一个地方，而中耳和耳道形成在另外一个地方。
The implication of that is in children with oral atresia, the cochlea is normal, and the problem is a conductive hearing loss where the sound can't get into the cochlea. So most children with oral atresia have normal cochlear function. So how do I evaluate children with oral atresia? There are certain syndromes that are associated with oral atresia, including Goldenhar or hemifacial microsomia. Treacher Collins, when there's underdevelopment of the middle face as well as the ears. Children with Down syndrome have very narrow ear canals. So I want to know, what is the status of the hearing and the health of the other ear if the atresia is only in one ear? I want to know, how is the child's speech and language developing? I want to know, how is the child's speech and language developing?
我想知道，患者的他的语言发育能力是怎么样的？
Is there a family history of oral atresia? And are there other medical issues that seem to be associated with oral atresia, namely the kidney and the spine? When I do the physical exam, I want to know, what is the degree of microtia? Ears come in many different shapes and sizes, and so there's a grade of microtia that I assign to the ear. Is there no ear canal, atresia, or is it a very, very narrow ear canal that we call stenosis? If the canal is very narrow, skin can become trapped in the canal, which can lead to a skin cyst called cholesteatoma. Which ear? Is it in one or both ears? Are there any pits or tags associated with the ear? The facial nerve is the nerve that moves the muscles of the face. It lets us smile and close our eyes. I want to know, is the facial nerve working? Because the facial nerve runs through the ear bone. We talked about the status of the... So then how are we going to assess the hearing in a newborn who is born with oral atresia? If the canal is open, we can do otoacoustic emissions. This is sound that the cochlea makes that we can record. The cochlea makes sound, yes,
Okay.
and we can record that sound with very, very special microphones. But in children with no ear canal, we have to rely on the ABR. The ABR measures the electrical activity in the hearing nerve and the brain when you stimulate the ear with sound. We used to assess hearing with these nice ladies and a bullhorn going off against this little tiny infant. So how is my child's hearing tested, and at what age should it be tested? The ABR should be done within the first 3 to 6 months of life to document the hearing status.
之后完成，来记录他的听力情况。
As children get older, we can do hearing testing in the audiology booth.
记录他的听力情况。
As children get older, we can do hearing testing in the audiology booth.
当这个患者
I want to know, how is the child's speech and language developing?
我想知道患者的他的语言发育能力是怎么样。
As they get even older, around the age of 4 or 5, we can do a true behavioral audiogram. So this is an audiogram of a child with oral atresia on the left side. Normal hearing is above this line. The circles are the right ear. We can play games with them to assess how well they are hearing. As they get even older, around the age of 4 or 5, we can do a true behavioral audiogram. Or 5, we can do a true behavioral audiogram. So this is an audiogram of a child with oral atresia on the left side. Normal hearing is above this line. The circles are the right ear. The boxes are the left ear. The circles are the right ear. The boxes are the left ear. Normal hearing is above this line. The circles are the right ear. The boxes are the left ear. With a moderate to severe hearing loss, in the left ear.